Councilmember Nadeau, you ready?
I'm good.
Awesome. Wait. Okay. With regular. Councilmember Nadeau, I'm told by my staff that all of the members are supposed to be here, so why don't we give it a minute?
No problem. At your service.
Oh wait, we're at 4. Just missing 1. Well, actually, I have a lot to say, so we're just gonna go ahead and get started. You good? Okay. Good afternoon. I'd like to call this meeting to order. Today is Monday, February 10th, 2025. The time is 3 p.m. This is a regular meeting of the Committee on Health, and we're holding this meeting in room 120 of the John A. Wilson Building. I'm at-large Councilmember Christina Henderson, Chair of the committee. We've been joined by Councilmember Zachary Parker from Ward 5, Councilmember Brianna Doe from Ward 1, and Councilmember Charles Allen from Ward 6. We have a quorum of the committee. Today, we will vote and consider one piece of legislation, Bill 26-25, the Certificate of Need Improvement Amendment Act of 2025. Bill 26-25 was introduced on January 6, 2025 by myself, council members Allen, Bonds, Lewis, George, and Parker. This was a reintroduction of Bill 25-948, on which the committee held a public hearing on October 9th, 2024. Since the two bills as introduced are identical, council rules permit Bill 26-25 to move to a committee markup without an additional public hearing. 35 states, including the District of Columbia, use Certificate of Need, or CON, programs as a tool to regulate the supply chain of certain healthcare services. In the district, in order for a healthcare entity to open a new facility, expand an existing facility, or modify its services it provides, the facility must apply for a CON from the State Health Planning Development Agency, also known as SHPTA, within DC Health. The CON application process can take 6 to 9 months, and the application fee can range from $5,000 to $300,000, depending on the size of the project. Along with legal fees and potential loss of revenue from delayed openings, the costs of the CON are substantial for health entities in the district. I will say that during my time as chair of the committee, challenges with the CON process are probably one of the most frequent complaints that I hear about from our healthcare entities. Currently, the district has one of the broadest CON programs in the country, requiring CONs for 25 different types of healthcare services. A full list of current services is included in the committee report. While I acknowledge the benefits of the CON program related to uncompensated care and the practice of large health facilities, I do believe the district's CON program is currently creating an unnecessary and burdensome obstacle for the expansion of much needed healthcare services in the district. This bill was introduced and intended to streamline and focus our CON program in order to make it work better for district residents and healthcare providers. Specifically, this bill, as modified, exempts from CON programs certain types of healthcare entities that only DC and a handful of other states include in CON review, including virtual provider platforms and networks, primary care, office-based specialty care, dental care, outpatient and residential behavioral health practices, and our federally qualified health centers. We heard from many providers that the CON process is a disincentive to open these critical healthcare services here in the district, and that many providers choose Maryland and Virginia locations instead. In place of a CON, the bill requires the district's Department of Health to create a streamlined registration process for these entities. The bill also exempts CON certain types of capital projects, including non-patient care projects like HVAC upgrades and parking garages. Yes, we were requiring people to go through CONs for that. It also exempts for facility renovations that do not affect healthcare services and replacing major medical equipment. We heard through testimony at the public hearing that the CON process disincentivizes facilities from making critical upgrades to better serve patients. The bill increases the financial thresholds for CON review for capital expenditures and major medical equipment to better align with inflation, and makes the project timeline for construction projects more flexible. We increase the threshold for the change in the number of licensed beds that triggers a CON review from 10% to 20% of total beds to avoid facilities going through a lengthy process for perhaps small changes in their operations. We expand the definition of uncompensated care to allow for hospitals to count treatment of non-district residents towards their 3% uncompensated care requirements. The district is a regional hub of high-quality healthcare services, and hospitals cannot turn away non-district patients. We also increased the transparency by requiring SHPTA to post on the DC Health website a complete list of CON applications from the previous 3 years, including information about the project and SHPTA's determination regarding the application. And we add a seat to the statewide health coordinating council for a representative of an incorporated association of hospitals. This change was suggested by the DC Hospital Association because of the outsized impact the CON program has on hospitals. Because the committee received this recommendation after we circulated Friday, an amended committee print and committee report were circulated at around 11:44 this morning with this change. In addition to making these changes to the CON program, this bill also proposes several clarifying amendments regarding DC Health operations. First, the committee has received concerns from small cottage food business owners that DC Health has not implemented the change to the law by the council in 2020, allowing for cottage food sales to district retailers. The committee print clarifies that cottage food businesses can sell wholesale to licensed food establishments in the district. And the committee has confirmed the language with DC Health that they will now update their requirements to reflect this language. Second, the committee received feedback from the Acupuncture Society of Washington regarding the health occupation revisions bill that we did in 2024 when it was too late to make changes to that legislation. They expressed concerns about the name and makeup of the new Board of Integrative Healthcare, which includes acupuncture, chiropractic, and neuropathic medicine. The committee print responds to their recommendations by changing the name of the board to the Board of Acupuncture, Chiropractic, and Neuropathic Physicians. The committee print also removes the medical physician seat as well as one of the 2 consumer seats. So we are decreasing the board size from 9 to 7 members. Finally, the committee print incorporates suggested language from DC Health to modify the requirements for licensed graduate social workers. The committee print would allow LGSWs to become licensed after completing their graduate education and allow for them to renew their license once they either pass the national examination or complete 1,500 hours of supervised social work practice. This modification will allow DC Health to move forward with amended regulations that allow for this pathway to licensure for graduate social workers, which will increase the district's behavioral health workforce while still ensuring high quality care. I want to note that the Office of the Chief Financial Officer reports that this bill will have a cost of $586,000 in FY 2025 and $2.1 million over the financial plan. The biggest cost to this bill is that DC Health is saying they will need 2 FTEs to implement it, as well as IT costs for them to set up a registration process that DC Health asked for. Although I understand that the new registration system requirement requires staff to set it up, I'm dubious that 2 additional staff are needed to run a system where entities only need to register and renew their registration every 3 to 5 years. I also wonder why the reduction in scope of the CON program does not free up staff resources to work on a new registration system, or why the OCFO cannot account for that revenue that will be generated from those registration fees. I would appreciate the opportunity to continue working with DC Health and the OCFO to reduce the costs of implementing this legislation. There has been this pattern I have seen, especially in the last 6 months. Any bill, add 2 FTEs. But with that, I'm going to open the floor for discussion on this bill. Councilmember Allen.
Thank you, Chair Henderson. First off, just a big commendation to you and to your staff for this. This is a big lift. I know something you've been working on for quite a while. So just congratulations on getting this to this point. In my early part of my career was focused on public health, and I have a master's in public health and studied the CON process. Worked on that a bit when before I entered working in this building, and it is complex. There's a reason for it because healthcare is both a marketplace and not a marketplace at the same time. And so the CON process has a point to it to help make sure that we have thoughtful distribution of healthcare resources and services, because if we left the market completely to itself, we would further the inequity that we see in healthcare access. So there's a reason to it. it can also get so laborious that it doesn't help us achieve what we want. And I think that's where the district has found itself. And so I think these are some really smart modernization reforms that really bring the CON process into line to ensure that we can deliver high quality healthcare, we can expand healthcare, and we don't hold back investment in improved healthcare access. So I really know that a lot of work went into this, a lot of compromise probably along the way. And so I really appreciate the hard work that it took to get here. I will echo your points, though, from a staffing perspective. If this is going to modernize and streamline the process, as I believe it will, by that very logic, there should be freed up some of those same FTEs that perhaps are needed somewhere else, which again, I'm not entirely convinced they are. But at a minimum, it should be a wash. And so I'm disappointed that that's not included here in the FISP, but I am not surprised. We've seen this before. So we will all continue to work and let us know how we can support you in that, because I think what you outlined makes a lot of sense. So again, my thanks for the hard work that went into this. Look forward to supporting this, and I think it'll make a meaningful difference in healthcare access and investments across our city.
Thank you, Councilmember Allen. Anyone else? Okay, I want to note we've been joined by Councilmember Wendell Felder from Ward 7, I think, or at least I see his box. So I hope he is there. I do want to note, Councilmember Allen, too, that one of the things that I think is important is, as we're talking about generating economic development, particularly in downtown and others, I've heard from plenty of providers who want to be in the district, but because of our CON process, will open their practices on the border of Maryland or the border of Virginia, which forces our residents to have to travel in order to seek care. And so streamlining the CON process, I think, is actually helping our economic development in terms of getting more businesses, because they are small businesses, though they are providing healthcare, to choose to open in the district. And so, I'm hopeful that this FIS does not impede our ability to move forward on this legislation being implemented this calendar year. But with that, I'm going to move the draft report and committee print for Bill 26-25 as circulated this morning at 11:44 a.m. in block, with leave for staff to make any technical conforming changes. All in favor, please say aye.
Aye.
Okay. Any opposed? Great. All right. Let the record reflect that vote was unanimous. This concludes our meeting. The committee is in the midst of performance oversight season. And so on Wednesday, February 12th at 9:30, we'll hold our next performance oversight hearing on the Office of the Deputy Mayor for Health and Human Services, as well as the Department of Healthcare Finance. The deadline for members of the public to sign up is today at 5 o'clock. With no further business before the committee, the time is 3:12 p.m. and this meeting is adjourned. Thank you, everyone.